Namaste, myself Triveni Khurana, Assistant Professor, Faculty of Physiotherapy and Diagnostics, JVM. Today we are going to discuss about development, intrauterine development. Before going to intrauterine development, let's see the periods of development. Periods of development, the first 8 weeks in the intrauterine life, it is known as pre-embryonic period. After 8 weeks, it is known as embryonic period. When the child comes to out of uterus, it is known as neonate. And up to 4 weeks, it is used to known as neonate. And 4 weeks till 1 year, neonate becomes infant, and 1 year up to 3 years, it is known as toddler. Three years to 6 years of age is known as preschool going age, and school going age is 6 to 9 years. Now after 9 years up to 12 years, it is known as childhood stage. And 12 years up to 18 years known as adolescence. After 18 years, adolescent becomes the adult till 65 years, and 65 to 90 years or above 85 known as geriatric age. So these are the periods of a human life cycle. 8 weeks pre-embryonic stage, more than 8 weeks embryonic stage, up to 4 weeks embryo becomes a neonate, and 4 weeks up to 1 year neonate is known as infant. 1 year to 3 years becomes a toddler. 3 years to 6 years known as preschool going age, and a school going age is reported as 6 to 9 years, and childhood age has become 9 to up to 12 years. 12 years up to 18 years, childhood age becomes into adolescent, and adolescent after 18 years becomes the adult, up to the 65 years. 65 years and beyond 85, the period is known as geriatric period. So how an embryo forms in the intrauterine cavity? By the fusion of female gamete known as ovum and the male gamete known as sperm. When ovum and sperm fertilized in the fallopian tube, it is known as zygote, and it takes minimum 3 days in the fallopian tube to become a zygote. Zygote is a 16 to 18 cell division stage and also known as morula. And now after 3 days, morula reaches to the uterine cavity. In the uterine cavity, it rests on the bed known as functional layer of endometrium. When the morula reaches into a functional layer of endometrium, it embedded in the endometrial layer further, and this stage is known as implantation. So first 3 days it is a zygote, and for 2 weeks it is implanted stage, what is the morula, and the outer layer of morula is known as trophoblast, and the central arranged cells known as blastocyst, and the blastocyst forms a cavity in between known as blastocoel. Now the layer trophoblast becomes endoderm, ectoderm and mesoderm. So three germinal layers are formed by the trophoblast. Three germinal layers are mesoderm, endoderm and ectoderm, which are responsible for the production or development of our tissues and organs such as heart, lungs, abdominal organs, bones, nervous system. These are made up of by mesoderm, endoderm, ectoderm, which is the layer formed by the trophoblast. Other than these germinal layers, trophoblast also forms amnion and inner cell mass. And this blastocyst, it becomes a placenta and the chorion. The chorion and amnion together forms a sac, which is known as amniotic sac, in which the embryo develops. And the placenta is the tissue which is used for the nutrient and excretion for embryo from the mother by the umbilical cord. Now this is the morula stage, and morula becomes the embryo, and further intrauterine development carries by function of mesoderm, endoderm and ectoderm. In the intrauterine cavity, the embryo develops up to the 40 weeks of gestation. At approximate 34 to 40 weeks, the embryo becomes the neonate. Now we are further going towards the neonate or infant milestones, which is the prone position. When the neonate or infant attains prone position at birth, infant has a general flex posture. At the age of 6 weeks, his pelvis going to flatten position, and at the 4 months, his or her head and shoulder lifts from the floor. This is in prone position. And at the 6 months of the age, the neonate arms in the extended position. Now the second activity which I used to assess is pull sit-ups. At the birth, there is a complete head lag. When at the 6 weeks, there is a head control of the baby. At the age of 4 months, there is no head lag. Now the third component, we have to assess the patient or baby's sitting position. At the week of 6 weeks, there is a curved back support in the sitting position. At the 6 to 7 months, baby is sitting without support. At the age of 9 months, baby is sitting without support. Now the fourth component for assessment is the walking and standing. At the age of 6 months, the baby stands without support. At the age of 10 months, the baby pulls to stand without holding any object. At the age of 12 months, baby stand and walk without support. At the age of 15 months, patient or baby walks independently. Now these are the motor milestones, gross motor milestones. Other than gross motor milestones, we have a pincer grasp, pinch, release. These are the fine motor grasp. Now other than these motor grasps, we have a language milestones which are attained at the 8th month, such as ma, ba. At the age of 12 months, baby used to say mama, baba, bisyllabi. At the age of 18 months, baby used to say 10 words. At the age of 24 months, baby linked the sentence. And at the age of 3 years, baby is easily trying to storytelling.